Hello, and welcome to another edition of Medicare Simplified with your host, Dave Miller.
Hello, everyone. Welcome back to another edition of Medicare Simplified. I'm your host, Dave Miller. Today, it's going to be a little bit different discussion with Lynette. She was kind enough to join us again. And we're going to talk about being admitted for observation, treatment, or regular what's paid for? What is it paid for? Let's get Lynette in here and start the conversation. Hello, Lynette. Welcome back again.
Thank you. And how are you today?
Yeah, we're still doing good. A lot of good information the last time we spoke, and I'm hoping to continue that because one of the problems being an insurance agent and a broker, so I handle many companies and many counties in the state of Pennsylvania, is that people don't understand observation is not necessarily covered by Medicare or your plan. In Medigap, it's one thing. In Medicare Advantage, it's another. In non-Medicare insurance, like under 65, it's another. It's confusing. And a lot of times people get taken to the cleaners with horrendous bills. So Lynette, you've had experience in this, firsthand experience. And I know you said you had a friend that went through a situation.
Mm-hmm. Yes, I did.
And I would like you to share that with us so people understand.
Not only a friend, but I've had several patients that this has happened to.
And that's what I want to talk about.
Okay.
How to avoid getting hammered with a very large bill from the hospital. How do they go about making sure that they will be covered? What is the difference between observation admission or treatment admission or admission in general to the hospital for like long-term care? So why don't you go ahead and explain what happened with your friends and people that you've known or worked with?
Okay, well, my first advice is everyone should ask if they're being admitted to the hospital, either from their doctor or from the emergency room. We're admitting you. Your first question is, am I being admitted for treatment or am I being admitted for observation? Now, if you're being admitted for treatment, that can be an IV. An IV is a treatment in the hospitals, say you have an infection. Observation, well, say you fell down at home. And we'll talk about my friend, but say you fell down at home, and so they didn't find any actual fractures, but they're going to keep you under observation for maybe a couple of days or a few days because they want to know what made you fall and make sure that there's no backlash from this fall. That's observation. Okay, if you're admitted for observation and then they determine that you need to go to a facility for rehab, okay, a facility for short-term rehab because you fell and they don't want you to go home with a chance of falling again. So they want you to go to rehab. If you're admitted for observation, your insurance may not pay for that hospital stay and they won't pay for that short-term rehab stay. Now, I can give you examples of, I actually had a friend whose father was a veterinarian. And he was living with her. He was up in age. I believe he was in his 90s at the time. And he fell at home. So she had him go to the emergency room. They evaluated him. They didn't find a fracture, but they admitted him to the hospital. Now, they are not required to say that he's admitted for observation. So they admitted him to the hospital because they wanted to observe, make sure there wasn't a problem, or why did he fall? They determined that he needed to go to short-term rehab. So he's in the short-term rehab facility now for a couple of days, which Medicare will pay for. I believe 100% they will pay for that short-term rehab for up to 21 days if documented necessary. And she was told after he was there for 2 or 3 days that it wasn't going to be covered because he was admitted in the hospital for observation. Okay, so she called me and she goes, what do I do? What do I do? I told her to call the hospital and find out if there was any treatment given to him while he was there. And of course, they did find treatment. They reversed that. And then his stay for the short-term rehab was covered. But every patient needs to ask, am I being admitted for observation or for treatment? I've had myself patients admitted to the short-term rehab facility that I was working in. After 3 days, the social worker comes up to them and says, your stay here is not covered. And so then the family has to advocate for that patient, or that patient has to advocate for themselves. And maybe the nurses and the therapists need to help advocate to get that stay covered, turn that observation to admission. So always ask. It's so important.
And this is where medical billing comes into play too, because they're the ones that have to do the reversal and changing it. You know, the hospital has to do one thing, medical billing has to do something. It's not
Yes.
just one thing, it's a series of things that get set in motion that have to all happen in order for you to have that covered. And
Right. And, we didn't mention this, but the hospitals, they can admit somebody, and Medicare can then come back to the hospital and said, no, they should have been admitted for observation, so we're not paying you. So it is a two-way street with the hospital and the patient, but if there's any kind of treatment, they should be admitted under treatment. And if they tell you that they're admitting you for observation, then you say to them, my insurance may not pay for observation. Either I need to be admitted or I need to go home. And if they say, well, if you're going home, sign this paper, don't sign that paper. Do not sign that paper, because you're releasing the hospital from any liability if something really was wrong with you and you needed treatment. Did that all make sense?
absolutely, because if Medicare says, well, you're not getting paid, and then let's say you have Medicare Advantage for an example, and Medicare Advantage says, well, we're not paying that because observation is not covered. Guess who's paying 100% of the bill? You are. And that's not going to be cheap. And that's when lawyers need to get involved, and it becomes a nightmare.
A nightmare. But also with standard Medicare, not a Advantage plan or a HMO plan, but with standard Medicare, if the hospital admits you and they maybe 3-6 months down the road determine that patient did not need to be admitted due to the documentation, then the hospital gets stuck with the bill. They can't bill you if they accepted the Medicare payment. So the hospital can get stuck, or the patient can get stuck.
And you get stuck enough, then they start raising their rates. The good thing is, though, for people on Medicare, the hospital has to accept the contractual amount that was agreed upon between Medicare and the hospital facility. They can't bill Medicare for anything they want. They can only bill for what's agreed to in the Medicare contract that they signed.
Right.
They can bill 15% above it and get it, but that is the maximum. And same thing with Medigap, Medicare Advantage, it doesn't matter. This is the same thing for both types of policies. So it's not just Medicare Advantage or Medigap. Same thing for both. Or if you have nothing but basic Medicare, it's still the same thing.
Right. There's an agreed to amount that is going to paid. And with Medicare, that agreed to amount is mostly based on diagnosis.
And you want to talk about some fun. I know you've seen them, I've seen them, but you get the detailed listing of what was billed.
Yes.
You know where I'm going.
Oh, I know where you're going with this one. Because they
so
need that bill.
A Band-Aid is some kind of injury, protective injury covering. It's a Band-Aid.
That's right.
Or what about that one you told me about? What was that?
Okay, there's an expiratory respiratory system.
What the heck?
An expiratory respiratory system. And that is that box of 7 tissues, that little box of 7 tissues that they put on your tray table. That's the expiratory respiratory system. So
I love it. And how much was that?
That was about $14.
For 7 tissues.
Yes. It might have been 8 in the box. I didn't count them.
That's like the military paying $400 for a plumber's wrench or $900 for a toilet seat.
Mm-hmm.
Maybe that's where I got the idea.
But that's every little, if you ask for the detailed bill, you will be amazed at some of the things that are on that detailed bill. The hospitals, they're putting every single item on that bill because that gives them more power when they go to negotiate that price that they're going to get paid for that diagnosis.
No.
And you do know that they only pay for one diagnosis.
Right.
if you go in the hospital with a fractured hip and you develop pneumonia, they're not going to. They might discharge you from the fractured hip and readmit you for the pneumonia so that they can get paid for it.
But if you have Medicare Advantage and they do that, now you got a second copay. Beware.
Yeah, gotta watch everything.
Don't let them discharge you because you developed pneumonia. That's on them. Make them suck it up. Don't let them discharge you and readmit you because let's say you had a $200 copay for inpatient hospital for your hip. Well, now you developed pneumonia, like you said. Well, we're going to discharge you and readmit you. Okay, but I'm not paying you another $200. Put it in writing. No copay needed, or you're going to get stuck for another $200 or $300 or $400, whatever your inpatient hospital is. Or if you have like a per day thing, like from days 1 to 4, and you're in there 5 days, then all of a sudden you get pneumonia. Well, now you're going to start that 1 to 4 all over again. It gets expensive and it's money out of your wallet. Don't let them do it. Lynette, you said you had somebody, a friend or something that had an incident and it wound up into a headache about the nursing home and, you know what I'm talking about?
I think where you're going with this is when you're admitted for, say, short-term rehab.
Thank you. Yes.
Okay. You're admitted for short-term rehab. Again, that is you had a fractured hip and they're going to send you from the hospital now that you're stable to the short-term rehab facility where the job there is to get you back on your feet so that you can go home. Or maybe you had abdominal surgery and you're too weak, or open heart surgery. So you're going to go to short-term rehab just to get your strength back on your feet. You can go home. Okay. Now, say a nurse in that facility, okay, happened to write, patient ambulated down the hall tonight. Well, somebody reviewing that chart from the insurance company, Medicare or one of the HMOs or whatever, they look and say they ambulated down the hall tonight. Well, then why did they keep them 4 more days? We don't have to pay for that. Now, in that case, the facility's probably getting stuck with that bill, unless they had you sign some kind of paper, but they're going to get stuck with that bill. But if they had simply put ambulated down the hall with assistance, that's the whole difference. So yeah, it goes back to making sure that the staff in the nursing home or the staff are well trained into documenting what really did happen. I mean, yes, if they are ambulating all over the short-term facility, maybe they shouldn't need to be there. But if they needed assistance, they do need to be there. I hope that made sense.
It did. And that's, again, paperwork, detailed, writing out what happened, when it happened, and then it gets into coding, which is another nightmare on itself. I'm sure you know about that.
Oh, yes.
1104, and it should have been 1140. You know, it's just.
And then you're denied payment.
And then it's another nightmare. And sometimes a guy like me can help you out, but a lot of times, you know, it takes me maybe 2-3 days to get with the right carrier, to get the people I need to talk to and find out what was wrong. Then I call back the client and I give them the information, and they have to do. There's only so much someone like myself can do. I can do some research and digging, but in the end, it's going to be you and the facility fighting it out. And
I'm kind of proud of the fact that in my 47 years of practice, I really only ever had one insurance denial. And that was I wanted a patient to stay in the short-term rehab for 3 more days so that I could train them to be safe on the stairs, because they knew they had stairs, concrete outside stairs, to get into their home. And they denied my 3 days. But it is part of the therapist or the doctor's job to advocate for that patient too. So I called the insurance company and I told them that I needed them 3 more days so they could negotiate those stairs safely to get home. And they said, no, we're going to send her home. And I said, okay, that's fine. I said, she's going to fall on those concrete steps on the way home, and I'll get her for another 3 weeks after her next hospital stay. I got my 3 days.
And that's the way you handle that situation.
Exactly.
You definitely got that down, Pat. But that was smart in what you did, because had they just said that's it, and then she did fall, another surgery, and that would have cost them a fortune.
that would have cost them a big fortune. And I think another point there is that patients, therapists, and families all need to advocate for
Absolutely.
the patient.
And that
Advocate is a big word.
and
So.
a very valuable word, because it's a difference between taking out a loan or not paying much at all.
Right.
And
Right.
COVID really hit hospitals and care facilities hard, and they lost a lot of money. They made some money, some lost some money, some of them it was just a nightmare. But nonetheless, make sure you are only paying the correct amount. And Lynette, once again, I thank you for your valuable time and knowledge, experience, and I hope the listeners are paying attention and taking notes, because these are valuable tidbits of information. And how long have you seen this go on? How many years?
47. It was totally different in the 70s than it is today. But I've seen a lot of changes, and I can't say that the changes have been for the better.
I agree. Lynette, again, thank you very much for your time. And I think we've got one more conversation coming up, and we'll have that for you shortly.
Okay, thank you.
Ladies and gentlemen, this has been Lynette again. She's kind enough to share some time and wisdom with us and experience. 47 years, it's a lot of knowledge. A lot of things have happened that she's willing to share some of this with you. And I hope you appreciate it as much as I do. So make sure you hit the little subscribe button. Don't forget to hit the like button. Leave some comments, questions. We'll be happy to answer them. And if I can't, I'll get a hold of Lynette and I'll get an answer for you. But I appreciate you tuning in. It's been wonderful talking to you again. And I look forward to continuing our journey of doing things right the first time. Have a great day. If you've enjoyed this podcast and don't want to miss future episodes of Medicare Simplified with me, Dave Miller, please subscribe wherever you get your podcasts. And don't forget to check out my book, Medicare Ready, Set, Go, available on Amazon in paperback and Kindle format. If you're looking for Medicare advice, please reach out to me at dave@mig4u.net or online at mig4u.net.